Welcome to OET Writing Live presented by Tiju Sir Academy. And this is Aishwarya. It's very good evening. Very good evening, everyone, to yet another live session from Tiju Sir Academy. And today we're going to have our writing live. Yes, so I am just taking my couple of minutes so that our regular participants can be with us. Yes, Jansi, Joy, Shichi, Shailam. Hi, very good evening. Very good evening, everyone. John Matthew. Hi, John. Good evening. I hope you people are having a great day over there. It's 5:36 here in the evening. Hi, Sharanya. Good evening, Sharanya. Ramya, Abhilash, Adra, Nitin, Tessie Korea, Neetu, Little Den, Miduna, Jacqueline, Jishma, Elias. Yes, very good evening. All right. Hi, Sophie, Sanob, Beena, Anju, Linda, Ashish. Hi, everyone. Welcome to the session. Danya Devu. Dini Matthew. Good evening. Good evening, everyone, and a warm welcome to yet another writing live session presented by Tiju Sir Academy, and this is Aishwarya. So, as usual, I would love to say thank you to each and everyone for being here, for your constant support, for being a constant viewer. And I really privileged to say that I'm getting an opportunity through this platform so that I can be in contact with you people, and we are getting a platform where we can discuss regarding OET related speaking, your writing, and everything. So thank you so much, everyone. So Swapna, Mohanan, Malanga, Neetu, Saumya. Hi, good evening, everyone. Adira Chandrada, Ajita Chandradas. Good evening, everyone. All right, so yes, so participants will join the session. So let's begin our today's writing live without wasting much time. So are you people ready? എല്ലാവരും ready ആണോ? Hi, Christina. Yes, Christina, I have seen your message in our YouTube. Yes, that's why I took the last speaking live. The last topic of my speaking live was epilepsy. That was regarding your suggestion, and definitely we'll be coming up with a role play regarding the epilepsy as well. Hi, Judy, Alfin, Seema. Yes, very good evening, Alicia. Yes. So yes, since you people are ready, let's begin our today's writing live. So in our previous writing session, we have discussed a writing live. Hi, Lenny. Hi, good evening. Welcome to the session. Jincy Johnson. Yes. So in our previous class, we dealt with a writing case note. And in our last session, we discussed regarding the date, address, salutation, referral line, and the purpose word of that particular letter. And in our today's letter, we are going to have, a detailed discussion regarding the introduction, body paragraph, and the rest of the discharge plan and rest of the letter through this in our today's session. So I'm going to have a quick brief at the same letter that we discussed in our last class. So the patient name is Mary Claire, age 38, occupation administrator, marital status single. That was about the patient. And when it comes to the writing task, refer to emergency department for acute management and investigation. So we are writing this letter to the emergency department. Full stop after registered nurse. No, Rosemary, we don't need to write full stop after registered nurse if it is in the designation part. Okay, so refer to emergency department for acute management and investigation. So what we need to give for this patient is acute management and investigation. Investigation means assessment, management is the treatment. So acute means he needs an urgent investigation or management. And what is his condition? Pneumonia with a question mark. So using the information in the case note, write a letter of referral to the admitting officer at the emergency department, Newtown Hospital. This was our writing task. And when it comes, this is an urgent letter, and we are going to see the case note as well. Patient name Mary Claire, age 38, occupation administrator, marital status single, past history asthma, hypertension, cholecystectomy, ankle fracture, depression, non-smoker. Medication Ramipril, paroxetine, fluoxetine, Ventolin, 2 puff if required. Allergies nil. So patient name is there, age is there, occupation is there, marital status is there. When it comes to the past history, his condition is there, and the medication name is also there, and allergies are also nil. And when it comes to 10th September 2014, history, 2-day history of runny nose, cough, productive of yellow sputum, slight fever, wheezy but not short of breath. Asthma, usually well controlled on preventer. So on 10th-9-2014, what happened with the patient is a 2-day history of runny nose, cough, productive of yellow sputum. So the patient has a history, 2-day history of runny nose was there, cough was there, productive of yellow sputum. Slight fever, wheezy but not short of breath. Asthma, usually well controlled on preventer. Examination, temperature, this much is there, pulse, BP 120/80, respiratory rate 12, obvious nasal conjunction. Yes, obvious nasal conjunction, throat red, ears normal, no increased work of breathing, no accessory muscle use, just scattered wheeze, no crepitation. So this was happened in the first visit. So 2-day history of runny nose, cough, productive of yellow sputum was there, slight fever was there, he was feeling wheezy but not short of breath, asthma, usually well controlled on preventer. Examination, temperature is there, pulse is there, and BP, respiratory rate, obvious nasal conjunction, throat red, ears normal, no increased work of breathing, no accessory muscle use, chest scattered wheeze, no crepitation. And when it comes to the assessment, viral upper respiratory tract infection, infective exacerbation of asthma, and the treatment says Ventolin 2 puff 4 hourly, continue preventer, medical certificate for work, review as required. On 12/9/2014, history, increasing shortness of breath and wheeze over last 24 hours, feeling feverish at times, minimal yellowish sputum, short of breath on minimal exertion. So in the first visit, what was his assessment? Viral upper respiratory tract infection, infective exacerbation of asthma. And the treatment, Ventolin 2 puff 4 hourly, continue preventer was there. And on 12th September 14, what happened? Patient has increased shortness of breath, wheeze over last 24 hours, feeling feverish at times, minimal yellowish sputum, short of breath on minimal exertion. This has happened on the second visit. And the second visit examination says the temperature is 38, pulse rate is there, BP is there, respiratory rate is there, throat was red in color, ears was normal, mildly increased work of breathing, chest widespread, wheeze, no crepitation. Assessment, infective exacerbation of asthma, symptoms got worse, and the treatment was provided in the form of amoxicillin. This was happened. And on today, that is 10:30 a.m. on 13/9/2014, history says more short of breath today despite prednisone and antibiotics. So even after taking the medication, the patient was having increased shortness of breath, feeling feverish and unwell. Examination, short of breath at rest. So he was feeling short of breath even at rest. Respiratory rate was 25, obvious accessory muscle use, and increased work of breathing. Pulse 112, BP 100/65, temperature 37.7, chest exam, widespread wheeze by basal crepitation. So examination, short of breath at rest. Respiratory rate was 25. Obvious ആയിട്ട് എന്ത് ചെയ്യുന്നുണ്ട്? Accessory muscle use ഉണ്ട്, that is increased work of breathing. So while breathing, he was using the accessory muscle. Pulse rate was 112, BP is also there, temperature is also there, and the chest examination says widespread wheeze by basal crepitation. Assessment, acute asthma with a question mark, pneumonia. Treatment, Ventolin nebules 5 mg. Review, 10:45 a.m. At 10:30 we had the situation. At 10:45 a.m. no improvement, still obvious respiratory distress. This was the condition of the patient, and that's why we are referring the patient to the emergency department for acute management and investigation. Management means treatment, and investigation means assessment. Alright, so what we need is acute management. Acute means short term, that's because of the chronic situation. So the patient needs an urgent assessment and management. And what is his final condition? What is provided here? Pneumonia with a question mark. That is the condition. So I hope you people got an idea regarding the letter. ലെറ്ററിനെ പറ്റിയിട്ട് ഒരു ഐഡിയ ഉണ്ട് എന്ന് വിചാരിക്കണം, ഒരു ഐഡിയ കിട്ടി വിചാരിക്കണം. So let's move on to the letter part. So in the previous day, the urgent letter ആയതുകൊണ്ട് തന്നെ can you please tell me how you people are supposed to start the body paragraph? ഇതൊരു urgent letter ആയതുകൊണ്ട് how we can start the letter? ഏത് ഡേറ്റിലെ കാര്യം പറഞ്ഞിട്ട്, which date can be used as the first body paragraph? Date 10 is there, 12 is there, and 13 September is also there. So urgent letter എന്ന് പറയുമ്പോൾ today's visit, exactly. So when it comes to 13, when it comes to urgent letter എന്ന് പറയുമ്പോൾ today's visit ഉള്ള കാര്യമാണ് നമ്മൾ ആദ്യം തന്നെ പറയേണ്ടത്. Yes, very good, yeah. Yes, last visit. So last visit date is 13th September 2014. And in our previous class we already dealt with the date part. Date ഏതായിരുന്നു? That is 13 September 2014 was the date. And when it comes to the address, what is the address? Using the information given in the case note, write a letter of referral. Write a letter of referral to the admitting officer at the emergency department, Newtown Hospital. So who is going to be our reader? The admitting officer, emergency department, Newtown Hospital. That was our reader's address. Reader's പേര് തന്നിട്ടില്ല, reader's name is not mentioned there. So we are supposed to start with a designation. So when we are starting the address with a designation, it has to be preceded by the article the. So the address should be written in such a way that the admitting officer, exactly Lavina, the admitting officer, and in the next line emergency department, and in the next line Newtown Hospital. This is something we also dealt in our previous session. So we dealt with the letterhead date, then we are supposed to go with the date, and third one, that is salutation. And the third one, that is salutation. So how the salutation should be? Dear admitting officer. So salutation എന്ന് പറയുന്നത് എന്താണ്? Dear admitting officer. So we dealt with the date, reader's address, salutation is dear admitting officer. Yes, exactly, Shailam, that's how we are supposed to write the address part. Dear admitting officer, address is also there, salutation, dear admitting officer. And when it comes to the referral line, RE, how we are supposed to write the name? What's the name of the patient? ഡിയർ സർ ഓർ മാഡം എന്ന് എഴുതാമോ? യെസ് ദിവ്യ, ഡിയർ സർ ഓർ മാഡം എന്ന് എഴുതിയാൽ തെറ്റല്ല. ബട്ട് സ്റ്റിൽ ഇവിടെ അഡ്മിറ്റിംഗ് ഓഫീസർ എന്ന് പറയുന്ന ഒരു ഓപ്ഷൻ ഉള്ളത് കൊണ്ട് ബെറ്റർ ടു ഗോ വിത്ത് അഡ്മിറ്റിംഗ് ഓഫീസർ. അതും പോസിബിൾ അല്ല എങ്കിൽ യു ക്യാൻ ഗോ വിത്ത് ഡിയർ സർ ഓർ മാഡം. ഓക്കെ. ആൻഡ് ദ നെയിം ഓഫ് ദ പേഷ്യൻറ്റ്, ഷീ ഈസ് 38 years old. സോ റെഫറൽ ലൈൻ എങ്ങനെ വേണം? മിസ് മേരി ക്ലെയർ, ഏജ്, put a comma, aged 38 years. Yes, very good, Needu. Okay, so you people can write the, let me know the referral line in the comment box. Patient age is 38 and the name is Miss Mary Claire. So I hope till referral line it's clear for you. Miss Mary Claire, age 38 years. Yes, very good. You can either go with small letter age or with capital letter age. Both are fine. Okay, so we dealt till the referral line part. Now, what we are going to see the introductory sentence. So, what type of letter? Using the information in the case note, write a referral letter. So, the type of the letter is referral. I'm writing to refer not Mrs. Miss Mary Claire Divya, who requires an urgent assessment and management. She is suspected to have pneumonia and is being transferred today. It's not she is there in the home, right? The visit, that's not a transfer case. So you don't need to tell that it's being transferred today. It's an urgent referral. Exactly. So I have provided the options for you people. So please let me know go through the options and let me know what is the correct statement. Option A, I am writing to refer Miss Mary Claire, who requires urgent assessment and management. Hi, yes, Suja, Neetu. I am writing to refer Miss Mary Claire, who requires urgent assessment and management. Option B, I am writing to refer Mary Claire, who requires assessment and management. Option C, I'm writing to refer Mrs. Claire, who requires assessment and management, or assessment and treatment. Yes, that's an urgent rental. Yes, solely. All right. Writing to refer Miss Mary Claire, who requires an urgent assessment and management. She is suspected to have pneumonia. Okay. All right. Yes, everyone is going with option A. Yes. An urgent assessment or urgent assessment, which one is correct? So better to go with urgent assessment and management. So management is not countable. So requires urgent assessment and management. If it is urgent admission, you can go with who requires an urgent admission. Okay. But here it is assessment, and in this context, assessment is not countable. An urgent എഴുതിയാൽ എന്ന് പറഞ്ഞാൽ urgent കഴിഞ്ഞിട്ട് assessment ആ വരുന്നതെങ്കിൽ and വേണ്ട. For urgent കഴിഞ്ഞിട്ട് admission ആണ് വരുന്നതെങ്കിൽ അവിടെ എന്ത് വേണം? And വേണം. Okay, Anu? If there is more than one query, how we will write? Yes, I will definitely discuss that. Refer Miss Mary Claire, who requires urgent assessment and management. Exactly. Yes, exactly, Sheija. It's uncountable. So option A is the right one. I am writing to refer Miss Mary Claire, who requires urgent assessment and management. This is the right option. And the second one, I am writing to refer Mary Claire, who requires assessment and management is there, but it is not mentioned as an urgent referral. That's why it is the wrong option. Moving on to third one, I am writing to refer Mrs. Claire. Here the name of the patient is completely wrong. Name of the patient is completely wrong. It's not Mrs., it's Miss. Here also the title is missing. So with a Mrs. alla, it's Miss Anna. And in the introduction, we are supposed to write the full name of the patient. Patient in the full name venam, not the surname. So I'm writing to refer Miss Mary Claire, who requires urgent assessment and management. I'm writing to refer Miss Mary Claire, who requires urgent assessment and management. This is the first option. Okay. Moving on to the next part. Here is the current condition of the patient. So first part ellarkum clear aano? Introduction, the first line. So here it is mentioned the type of letter, name of the patient and the purpose. So now we need to add the current medical condition of the patient. Then only it will become complete. Then only the introduction will be completed. So here is the option for the introductory part. So here is the options for the introductory part. So yes, she is suspected to have pneumonia. Exactly. Yes, option A. Yes, she is suspected to have pneumonia. Exactly. She is suspected to have pneumonia. Yes. She is assessed to have pneumonia. No, this is not an assessment case. It's a query case. So it's just a suspicion. She is diagnosed to have. No, we haven't done the diagnosis. She may have pneumonia. That is fine. She may have pneumonia. That is grammatically wrong. So the right statement is she is possible to have. Is it okay? She is possible to have pneumonia. Okay, grammatically, meaning wise, that is fine. But the more technical term that would be she is suspected to have. I hope it is clear. She is suspected to have pneumonia. That will be the most appropriate formal word, I would say. Okay, Anu? So we have done with the introduction. So the complete introduction will be, I am writing to refer Miss Mary Claire, who requires urgent assessment and management. And the second one is, she may probably better, she is suspected to have pneumonia. So that makes the introduction. And this is a referral letter. This is just a visit. So we don't need to mention about the discharge. And it's just a visit. We are not transferring the patient also. So we don't need to mention that as part. Well, doctor nanengil ingane edudamo ma'am. Doctor nanengilum I'm writing to refer in edudiyal, it's not wrong. Okay. She may have suspected. She may have suspected venda, she is suspected to have. Because suspected ennulla word avada vannu. Pinna may avada avashyilla. Okay. She is suspected to have pneumonia. So that's about the introduction. So I'm writing to refer Miss Mary Claire, who requires urgent assessment and management. And the second sentence, she is suspected to have pneumonia. That makes the complete introduction. Okay. Now we can go with the body paragraph. So since it's an urgent case, what we are supposed to write, which paragraph, which condition, 10th visit is there, 12th visit is there, and 13th, the last visit also there. So from where we are supposed to begin the body paragraph? Yes, if there is no discharge date, no need to mention the sentence following her discharge. Venda. This is not a discharge also, this is just a visit. Miss Mary Claire, who has symptoms suggestive of pneumonia, is being referred today for urgent evaluation. That is also possible. Suggestive of pneumonia, suspected case. Okay, yes, exactly. We are supposed to start with 10-day part. So I'll show you what happened on 10th. History says more short of breath today despite prednisolone and antibiotics. So even after taking these two medications, the patient was feeling short of breath on today. He was feeling feverish and unwell. Patient was feeling feverish and unwell. And the examination says short of breath at rest, respiratory rate, obvious accessory muscle use, and increased work of breathing. So he was using his accessory muscle while breathing. So respiratory rate is there, pulse rate is there, BP is there, temperature is there. Chest examination says widespread wheeze with bibasal crepitation. And we ask managed with the Ventolin nebules and doesn't have any improvement. These are the things that happened on 13. Shortness of breath, definitive symptoms and suggestive symptoms. Yeah, sure. So more short of breath. So when it comes to this particular letter on 13th 9 2014, what happened on today? The patient has short of breath even after taking the medication. He was feeling feverish and unwell. Examination says his respiratory rate, BP, pulse and temperature, and he was using accessory muscles while breathing. And the chest exam says widespread wheezing, bibasal crepitation is there. And the treatment was provided with Ventolin nebulizer, but there is no improvement in his condition. This was the thing that happened on today. Todayilthe karyam idana. And since it's an urgent letter, we are supposed to start the first body paragraph by mentioning about today's thing. Is that clear? Now moving on to the first body paragraph sentence. So please let me know what's the correct answer among the three options. Yes, today Miss Claire yes, so you people can go with the correct option. Today, first option says today Miss Claire presented with worsening SOB despite taking the previous medication. Option B, today Miss Claire presented with worsening SOB despite of taking the medication. Option C, today Miss Claire presented with worsening SOB despite taking prednisone and antibiotics. Yes, so A and C, most of you people are going with option C, and B and A are also coming up in between. Alright, so today Miss Claire presented with worsening SOB despite taking the previous medication. Option B is also there, and option C is also there. Alright. If B, no need of despite, exactly, despite of. Alright, so we are going to see the options one by one. So this is a referral letter. This is a referral letter. This is a referral letter, which means the patient, we are introducing the patient for the first time. We are patient introduced. So the reader doesn't have any idea about the patient before. The reader doesn't have any idea about the patient before. So when it comes to option A, today Miss Claire presented with worsening SOB despite taking the previous medications. So in option A, they have only mentioned the word previous medication, but the reader doesn't know about his previous medication. Okay, so the reader doesn't know about any previous medication. The case is completely new for the patient. The case is completely new for the patient. So the reader doesn't have any idea about the previous medication. Current management is given. Yeah. So previous medication the reader doesn't know. So it's not, if you are writing it as previous medication, the reader won't be getting a clarity over there. Reader they won't be getting any clarity because this is an unknown case. Yes, exactly. അതുകൊണ്ടാണ് option A wrong ആയത്. Exactly, we are talking about the current management. And when it comes to option B, today Miss Claire presented with worsening SOB despite of taking the medication. Here the word despite of is there. That is completely wrong. In spite of is there, but there is no despite of. Only despite should be there. Despite കഴിഞ്ഞിട്ട് off ഇല്ല, in spite കഴിഞ്ഞിട്ട് എന്തുണ്ട്, off ഉണ്ട്. And when it comes to option C, today Miss Claire presented with worsening SOB despite taking prednisolone and antibiotics. This can be considered as the perfect sentence. Today, Miss Claire, from body paragraph onwards, we are only using the surname of the patient. So, Miss Claire presented with worsening SOB despite taking prednisolone and antibiotics. This will be considered as the perfect statement among these two. So, അതാണ് ആദ്യം നടന്ന കാര്യം. And SOB, if you feel that the reader is familiar with the short form SOB, you can go with SOB. And if you think that the reader doesn't know the elaboration of SOB or doesn't know the short form SOB, so then on that context, you people can go for the full form, shortness of breath. You can go for that as well. I hope it is clear. Moving on. First sentence എല്ലാവർക്കും clear ആണോ body paragraphന്റെ? Shall I move on to the next slide? Shall I move on to the next slide? Yes. So, introduction നമ്മൾ കഴിഞ്ഞു. Body paragraphന്റെ first sentence നമ്മളായി. Today, Miss Claire presented with worsening shortness of breath despite taking prednisolone and antibiotics. So, reader should know what medication avada vannappo before coming here what medication the patient had taken. Patient endana eduthadenu reader ariyanam. Adananu nammal introduction il thanne first body line il thanne ee medicine eduthittum patient ne condition aayittu vannu ennu parayunu. Moving on to the next one. On examination, this is the statement. Her vitals were deranged and was febrile. She was using her axillary muscles while breathing. This is what happened on examination. Examination സമയത്ത് നടന്ന കാര്യമാണ്. നമ്മൾ അവരുടെ വൈറ്റൽസ് ഒക്കെ പറയുന്നുണ്ടായിരുന്നു. പിന്നെ എന്താണ്? We can avoid despite. It is mandatory to write ma'am. No, it's not mandatory. Yeah, it's not mandatory. Yeah. So her vitals were deranged and was febrile. She was using her axillary muscles while breathing. So my question to you people is, this is what happened. അയാൾ വന്നു കഴിഞ്ഞ് നമ്മൾ അവരെ ഓൺ എക്സാമിനേഷൻ അവരുടെ വൈറ്റൽസ് നോക്കി വൈറ്റൽ വാല്യൂസ് അവിടെ പറയുന്നുണ്ട്. പിന്നെന്താണ് അവർ വൈൽ ബ്രീതിങ് ഷി വാസ് യൂസിങ് while breathing despite ഉപയോഗിച്ചാൽ കുഴപ്പമില്ല. despite നമുക്ക് ഉപയോഗിക്കാം. So her vitals were deranged. നമ്മൾ അവരുടെ വൈറ്റൽസ് ചെക്ക് ചെയ്തു. എന്നിട്ട് എന്ത് പറയുന്നുണ്ട്? While breathing അവരുടെ accessory muscles എന്താണ്? She was using her accessory muscles while breathing. So my question to you people is, this is what happened there. So whether this statement is true or false. Does this statement is grammatically correct or not? This is my question. So patient vannu and we have done the examination, and what happened in the examination is mentioned here. So is there any mistake in the sentence? If there is any mistake, please let me know through the comment. Idinathu endengilum mistakes undo? Her vitals were deranged and was febrile. She was using her accessory muscles while breathing. Is there any mistakes? Deepthi Paul says is false. Okay. No, it's correct. All right. Yes. False. So why it is false, Deepthi and Miduna? Could you please tell me why it is false? Yes. Why it is false? Yes, you people telling me it's false. And I'm getting the options that it's true as well. So could you please tell me why it is false? എന്താണ് ഇതിലെ തെറ്റ് എന്ന് പറയാമോ? Her vitals were deranged and was febrile. She was using her accessory muscles. Yes. She was using. Deranged means it is not in correct way. Deranged means not normal. Yeah, not in range. Alright, I'll show you the part. Here, short of breath at rest. Respiratory rate is 25. Pulse, BP, temperature. So, നമ്മൾ 4 ranges അവിടെ തന്നിട്ടുണ്ട്. Respiratory ഉണ്ട്, pulse ഉണ്ട്, and was febrile. Also had signs of respiratory distress. Okay, deranged means deranged means not in range, not in correct value, not in proper value. Deranged means the vitals has been raised. There is a change in the vital condition. Okay, so here the respiratory rate is there, pulse is there, BP is there, temperature is there. Does all the vitals are changed? എല്ലാ ചേഞ്ചസും എല്ലാ വൈറ്റൽസും അവിടെ ചേഞ്ച് ആയിട്ടുണ്ടോ? ഏതൊക്കെ വാല്യൂസിനാണ് അവിടെ ചേഞ്ച് ഉള്ളത്? ഷീ ഈസ് യൂസിങ് അവരുടെ എല്ലാ വാല്യൂസും അവിടെ ചേഞ്ച് ആയിട്ടുണ്ടോ? വൈൽ ബ്രീത്തിങ് ഷീ യൂസ്ഡ് ഹെർ ആക്സസറി മസിൽ. ദാറ്റ് ഈസ് ഓൾസോ ഫൈൻ. സോ റെസ്പിറേറ്ററി റേറ്റ് അവിടെയുണ്ട്, പൾസ് റേറ്റ് അവിടെയുണ്ട്, BP ഉണ്ട്, ടെമ്പറേച്ചർ ഉണ്ട്. Temperature is normal, exactly. Temperature is normal. Pulse and RR, exactly, very good. So that is the mistake over here. So അവരുടെ 4 values തന്നിട്ടുണ്ട്. Respiratory rate was there. അവരുടെ respiratory rate തന്നിട്ടുണ്ട്, temperature തന്നിട്ടുണ്ട്, pulse rate തന്നിട്ടുണ്ടായിരുന്നു, fever ഒരു റേറ്റും കൂടെ തന്നിട്ടുണ്ടായിരുന്നു. All her vitals were not deranged. ഏതൊക്കെ ഉള്ളൂ? പൾസും റെസ്പിറേറ്ററി റേറ്റും മാത്രമേ അവിടെ എന്തുള്ളൂ? ചേഞ്ച് ഉള്ളൂ. റൈറ്റ്? അതുമാത്രമല്ല, ആൻഡ് ഷീ വാസ് ഫീലിംഗ് ആയിരുന്നു. സോ febrile means she became normal, right? So here the condition should be febrile, not febrile. She still have fever. So ഇതിൻ്റെ കറക്ഷൻ എങ്ങനെ വരും? Not her all vitals. നമുക്കതിനെ എങ്ങനെ എഴുതാം? Her pulse, and I'm just going with the short form RR, that is respiratory rates. Her pulse and respiratory rates were raised. Yes. So her pulse and respiratory rate were raised and was febrile. She still have fever, not febrile. This is the correction in the statement. Not her all vitals were deranged, only her pulse and respiratory rates were changed. Her pulse and respiratory rate were raised and was febrile. അവരെന്തുവായിരുന്നു? Not febrile, but it's febrile. And she was using her accessory muscles while breathing. She was using her accessory muscles എന്ന് പറയുമ്പോൾ അവർ accessory muscles യൂസ് ചെയ്തുകൊണ്ടേ ഇരിക്കുമായിരുന്നു അല്ലേ? പക്ഷേ അവർ ബ്രീത്ത് ചെയ്യുമ്പോൾ ആക്സസറി മസിൽ യൂസ് ചെയ്തു. ഒബ്സർവേഷനിൽ നമ്മൾ കണ്ട കാര്യമാണ്. സോ ഇറ്റ്സ് ബെറ്റർ ടു ഗോ വിത്ത് സിമ്പിൾ പാസ്റ്റ് ടെൻസ്. സിമ്പിൾ പാസ്റ്റിൽ പറയാം. സോ ഇൻസ്റ്റെഡ് ഓഫ് ഷീ വാസ് യൂസിങ്, നമുക്കവിടെ എന്ത് കറക്ഷൻ ചെയ്യാം? ഷീ used her accessory muscles while breathing. So here is the corrected statement. Her pulse and respiratory rate were raised. She was febrile and used her accessory muscles while breathing. Clear ano? On examination, yes, on examination നമുക്ക് പറയാം. എക്സാം വന്നപ്പോൾ അത് കഴിഞ്ഞ് എക്സാമിനേഷൻ നമ്മൾ കണ്ട കാര്യങ്ങളുണ്ട്. പക്ഷേ ഇതല്ലാതെ ഇങ്ങനെ ജസ്റ്റ് പറഞ്ഞാലും ഇറ്റ്സ് ഡസൻറ്റ് മാറ്റർ. എക്സാമിനേഷനിൽ കുറച്ചുകൂടെ കൂടിയ കാര്യങ്ങൾ നമുക്ക് പറയാം. ഇവിടെ ഓൺ എക്സാമിനേഷൻ വന്നു എന്ന് പറഞ്ഞാലും തെറ്റില്ല. സോ ഫസ്റ്റ് സെൻറ്റൻസ് എങ്ങനെയാണ് ബോഡി പാരഗ്രാഫിനെ? ദാറ്റ് ഈസ് ഓൾസോ ഫൈൻ ഷീജ, അത് പ്രശ്നമില്ല, അതും ശരി തന്നെയാണ്. സോ ടുഡേ മിസ് ക്ലെയർ പ്രസൻറ്റഡ് വിത്ത് വേഴ്സണിങ് SOB despite taking prednisone and antibiotics. അങ്ങനെയാണ് അവർ നമ്മളുടെ അടുത്ത് വന്നത്. And second sentence, her pulse and respiratory rate were raised. She was febrile and used her accessory muscles while breathing. അവർക്ക് പനിയും ഉണ്ടായിരുന്നു and she was using her she was febrile. Can we write? No. Even though her pulse rate and RR were elevated, she was febrile. അങ്ങനെ പറയാൻ പറ്റുമോ? Febrile is not the normal condition. Febrile is the normal condition. So she was febrile and used her accessory muscles while breathing. Okay, so even though നമ്മൾ യൂസ് ചെയ്യുന്നത് her pulse and rate were elevated, അതിങ്ങനെയാണെങ്കിലും ഒരു പോസിറ്റീവ് കാര്യമാണ് ഇവിടെ വരേണ്ടത്. പക്ഷേ രണ്ടും എന്ത് തന്നെയാണ്? നെഗറ്റീവ് തന്നെയാണ്. So you don't need to write that. So her pulse and respiratory rate were raised, she was febrile and her accessory muscles were in action. That is also fine. That is also perfect, Sanu. That is also no issues. You can go for that as well. So this is the second statement. Now moving on to the third part. Here is the third sentence. So on observation, widespread wheezing and bibasal crepitations are persistent. So is there any mistake in this first sentence? On observation, widespread wheezing and bibasal crepitations are persistent. Is there any mistake in the first sentence? If there is so, what it is? On observation, widespread wheezing and bibasal crepitations are present. Continuing care. Continuity alla, continuing care. Where persistent? Exactly. Bibasal is single word. That's it. You can write it in this way also. Bibasal single ആയിട്ട് വരുന്നതും doesn't matter. Yeah. On observation, not are but where. Yes. Exactly. Very good. So on observation, after on observation, we are supposed to keep the rest of the sentence in past tense. ഓൺ ഒബ്സർവേഷൻ കഴിഞ്ഞ് ബാക്കിയുള്ള കാര്യങ്ങൾ നമ്മൾ പാസ്റ്റ് ടെൻസിലേ പറയാൻ പാടുള്ളൂ. സോ ഓൺ ഒബ്സർവേഷൻ വൈഡ് സ്പ്രെഡ് വീസിങ് ആൻഡ് ബൈബേസൽ ക്രെപ്പിറ്റേഷൻസ് നോട്ട് ആർ പെർസിസ്റ്റൻറ്റ് ബട്ട് വേർ പെർസിസ്റ്റൻറ്റ്. Very good. So you people identified the mistake. So the third sentence should be on observation, widespread wheezing and bibasal crepitations were persistent. Were present. That is also fine. Now, moving on to the next part. Consequently, she was commenced on salbutamol nebulization 5 mg. Moreover, it did not improve her condition. Consequently, she was commenced on salbutamol nebulization 5 mg. Moreover, it did not improve her condition. So, is there any mistake in the second sentence? Yes, although okay. Consequently, she was commenced on salbutamol nebulization 5 mg. Instead of moreover, you can go with however. M capital. Yes, M is capital. Yes, M shouldn't be capital. Okay. Moreover, no need. As a result, yes, you people can comment in the comment box. What's the mistake over here? Yes. However, exactly. So on observation, widespread wheezing and bibasal crepitations were persistent or present. Both are correct. Consequently, she was commenced on salbutamol nebulization 5 mg. Moreover means in addition. പക്ഷേ അവിടെ in addition അല്ല വേണ്ടത്. It has to convey the meaning that even after commencing the medication, her condition hasn't improved. മെഡിക്കേഷൻ കണ്ടീഷൻ കൊടുത്തിട്ടും കണ്ടീഷൻ ഇംപ്രൂവ് ആയില്ല എന്ന് വേണം അവിടെ വരാൻ. So consequently, she was commenced on salbutamol nebulization 5 mg. എന്ന് പറഞ്ഞിട്ട് മോർ ഓവർ എന്ന് പറയുമ്പോൾ ഇൻ അഡീഷൻ എന്നുള്ള മീനിങ് ആണ് വരുന്നത്. ഇൻസ്റ്റെഡ് ഓഫ് മോർ ഓവർ വി ആർ സപ്പോസ് ടു ഗോ വിത്ത് ഹൗ എവർ. അവിടെ എന്താണ് വരേണ്ടത്? ഹൗ എവർ. സോ കമൻസിങ് എ മെഡിക്കേഷൻ ഇസ് എ പോസിറ്റീവ് തിങ്, but did not improve her condition is a negative thing. In order to connect positive and negative idea, we are using the connector however. I hope it is clear. Consequently, she was commenced on salbutamol nebulization 5 mg. Although it did not improve. Although suitable ano. Sanup anganeyanankil although has to be in the beginning. Although she was commenced on salbutamol nebulization, her condition did not improve. Angane varanam. Although eഴുതുവാണെങ്കിൽ. Okay? Yes, Shija. Now 5 mg ക്ക് മുന്നേ കോമ വേണ്ട. കാരണം ഡോസും ഫ്രീക്വൻസി എല്ലാം കൂടെ വരുമ്പോഴാണ് നമ്മൾ എന്ത് ചെയ്യുക? കോമ യൂസ് ചെയ്യുക. Moreover, we won't be using in OET letter also. OET ൽ നമ്മൾ അങ്ങനെ moreover യൂസ് ചെയ്യാറുമില്ല. That can be used in IELTS but not in OET. Clear ano? Is it clear so far? E under sentence. On observation, widespread wheezing and bibasic repetitions were persistent or present. Both are correct. Consequently, she was commenced on salbutamol nebulization 5 mg. However, എന്നിട്ടും it did not improve her condition. It did not improve her condition. Or other way of writing the same sentences. Consequently, she was commenced on salbutamol nebulization 5 mg, which was ineffective. Which was not effective. Or which was ineffective. അങ്ങനെ നമുക്ക് എഴുതാം. അപ്പം മോർ ഓവർ തൊട്ട് പറയേണ്ട 5 mg കഴിഞ്ഞിട്ട് നമുക്ക് എന്ത് ആഡ് ചെയ്യാം? Which was ineffective. Yes, so this is another way of writing the same sentence. However, which is not improved. However, it did not improve her condition. Angane ezhudam. Alla engil consequently she was commenced on salbutamol nebulization 5 mg, which was ineffective. Which was not effective. Angane ezhudam. Okay. Shall I move on to the next slide? Are you guys ready? അടുത്തതിലേക്ക് പോയാലോ? Yes. Okay. All right. Here is the next slide. So todayയിലെ കാര്യം എല്ലാം കഴിഞ്ഞു. What happened? അവർ വന്നു, വൈറ്റൽസിൻ്റെ കാര്യമൊക്കെ പറഞ്ഞു, ആൻഡ് ഒബ്സർവേഷൻ കുറിച്ച് കഴിഞ്ഞു, മെഡിക്കേഷനും കഴിഞ്ഞു. Now, once we complete the today's thing, todayയിലെ കാര്യങ്ങളെല്ലാം കഴിഞ്ഞു കഴിയുമ്പോൾ the next paragraph, second body paragraph എന്ന് പറയുന്നത്, second body paragraph, we have to start with the initial condition. So here is the initial condition statement. Initially, Miss Claire was visited the hospital with infected exacerbation of her asthma secondary to viral URTI. So I'll show you the initial visit part in the slide. Here, 2-day history of runny nose, cough productive of yellow sputum, slight fever, VC, shortness of breath, asthma usually well controlled, temperature കാര്യമൊക്കെ പറയുന്നുണ്ട്. So initial symptomത്തിനെ കുറിച്ചാണ് നമ്മൾ already medicine എടുക്കുന്നുണ്ട്. So we don't need to go for a detailed explanation of the initial symptom. We can just summarize. History of runny nose, productive cough. Assessment എന്തായിരുന്നു? Viral upper respiratory tract കൊണ്ട് infective exacerbation of asthma. And medication Ventolin കൊടുത്തു. This happened in the initial visit. So now here is a sentence for you. Initially, did not is correct. We are not supposed to write contractions. Initially, Miss Claire was visited the hospital with the infected exacerbation of her asthma secondary to viral URTI. Exactly. So initially, Was visited shouldn't be there. Visited is an active voice. Initially, Miss Claire visited the hospital with. Simple present can use suggestive symptoms of. No need of was. Miss Claire visited. Exactly. Initially, Miss Claire visited the hospital with infected. Is there any other mistakes? So first അയാൾ റണ്ണി നോസ് ഒക്കെ ആയിട്ട് വന്നു, നമ്മൾ വൈറ്റൽസ് ഒക്കെ നോക്കി, ആൻഡ് അസസ്മെൻറ്റ് എന്താ പറഞ്ഞത്? ഇൻ ആസ്മ കണ്ടീഷനാണ്. സോ നമുക്ക് ഫസ്റ്റത്തെ കാര്യം എങ്ങനെ തന്നെ പറയാം, ആസ്മ ആണ് സെക്കൻഡറി ടു വൈറൽ URTI എന്ന് തന്നെ പറയാം. ഓക്കെ, സോ I'll show you that part. Here, 2-day history of runny nose, cough, productive of yellow. We don't need to go for elaboration because in the first visit our history idarnu, examination idarnu, and the assessment says viral upper respiratory tract infection. So നമുക്കും എങ്ങനെ തന്നെ പോവാം, കറക്റ്റ് ആയിട്ട് വൈറൽ ഇതാണ് എന്നുള്ള കാര്യം തന്നെ പറഞ്ഞ് മൂവ് ഓൺ ചെയ്യാം. So initially Miss Claire visited, exactly, not the hospital, visited to hospital or presented to hospital. Visited ശരിയാണ്, presented ശരിയാണ്. Miss Claire, initially Miss Claire presented to or visited to hospital with infected. Is there any other mistake? Exacerbation, what's the spelling? Is there any mistakes in the spelling? That is also something that you have to be careful. Initially Miss Claire presented to hospital with infected. What's the spelling of exacerbation? EXA. Here the spelling mistake is also there. Exactly, exacerbation. EXACERBATION. So initially Miss Claire visited or presented to hospital with infected exacerbation of her asthma secondary to viral URTI. Exactly. Now the next part. Subsequently, that is a second day visit part. Subsequently, exacerbation of asthma secondary to viral URTI. Yes, so first this is correct. Initially Miss Claire was visited to hospital ആണ് with infected exacerbation ആണ് of her asthma secondary to viral URTI. Now moving on to the next part. Subsequently, 2 days later, she presented with a asthma കഴിഞ്ഞ് asthma secondary to viral. asthma കഴിഞ്ഞ് കോമ വേണ്ട, ഇത് ഇത്രയും കറക്റ്റാണ്. സെക്കൻഡറി ടുവിൻ്റെ ഇടയ്ക്ക് ഇവിടെ കോമ ആവശ്യമില്ല. മൂവിങ് ഓൺ ടു ദ നെക്സ്റ്റ് വൺ. Subsequently, 2 days later, she presented with a 1-day history of exertional shortness of breath, wheezing, accompanied by a fever and yellowish sputum. That happened in the second visit. ഇതിൽ ഏതാ കറക്റ്റ് ആയിട്ടുള്ളത്? ഓപ്ഷൻ എ ഓർ ബി? Yes. Subsequently, 2 days later. So in the first sentence is no need of both. Very good. Subsequently, 2 days later. രണ്ടും നമുക്ക് എന്തില്ല? ആവശ്യമില്ല. Subsequently or 2 days later. It's better to go with subsequently. She presented with a 1-day history of exertional shortness of breath and wheezing, and there is no need of comma over here, accompanied by a fever and yellowish sputum. Or you can go with, better to write along with shortness of breath and wheezing along with fever and yellowish sputum. So subsequently, she presented with a 1-day history of exertional shortness of breath and wheezing along with fever and yellowish sputum. Yes. So that's the correction in the first sentence. First, B nathu, subsequently she presented exertional shortness. ശരിയാണോ? Subsequently she presented exertional shortness. Is it correct? Is it correct? Here also presented with a varanam. With a Yes, exactly. With exertional shortness of breath and wheezing, no need of accompanied. Subsequently, it's not presented exactly. That's the main point. Subsequent visit alle. Appo the presented avo, that should be represented. That's the mistake. Actually, both the statements are wrong. രണ്ട് സ്റ്റേറ്റ്മെൻറ്റും എന്താണ് റോങ് ആണ്. So subsequently, she presented alla, she represented with 1-day history of exertional shortness of breath and wheezing, along with fever and yellowish sputum. Second sentence same engane correct cheyam. Subsequently, she represented with exertional shortness of breath and wheezing accompanied by a fever and yellowish sputum for 1 day. 1 day ആയിട്ട് വന്നു എന്നല്ല, the right statement would be, rather than going with this would be the correct one. Subsequently, she represented with 1-day history of exertional shortness of breath and breathing, along with fever and yellowish sputum. Okay? No for 1 day, exactly. So, ഈ correction ചെയ്ത first sentence ആണ് in the correct ആയിട്ടുള്ളത്. Moving on. On her chest auscultation, widespread wheezing was heard. Additionally, she was advised to continue using fluticasone 250, 2 puff daily with Ventolin, 2 puff 4 hourly. A fever should be there because fever is countable. So on her chest auscultation. So here on her chest auscultation parayam. On auscultation. Idu ezhudanam ennilla. This particular thing can be concise. So namukku endu cheyam? Concise cheyam. So that's the correction in the sentence. That's the only correction in the sentence. ഇവിടെ എന്ത് ചെയ്യാം? കൺസൈസ് ചെയ്യാം. ഓൺ ഓസ്കൾട്ടേഷൻ വൈഡ് സ്പ്രെഡ് വീസിംഗ് വാസ് ഹേർഡ്. എക്സാക്ട്ലി. അഡീഷണലി ഷീ വാസ് അഡ്വൈസ്ഡ് ടു കണ്ടിന്യൂ യൂസിങ്. ഒന്നെങ്കിൽ ഈ യൂസിങ് നമുക്ക് എന്ത് ചെയ്യാം? അതും കൺസൈസ് ചെയ്യാം. രണ്ടും എഴുതിയാലും കുഴപ്പമില്ല. ഐ എം ജസ്റ്റ് ആസ്കിങ് യു പീപ്പിൾ, ടെല്ലിങ് യു പീപ്പിൾ ഹൗ ടു കൺസൈസ് ദ ലെറ്റർ. Additionally, she was advised to continue fluticasone 250, 2 puff daily with Ventolin 2 puff 4 hourly. On auscultating her chest. അങ്ങനെ പറയണം എന്നില്ല. On auscultation. Obviously, auscultation എവിടെയാ ചെയ്യുക? Clear? Yes. Was heard. For which? For which she was advised to continue. For which nalla already continue was noticed edudam, kuഴപ്പമൊന്നുമില്ല. Notice is also fine. For which alla she was advised to continue aanu. This is not that we are starting here. നമ്മൾ ഇപ്പോൾ സ്റ്റാർട്ട് ചെയ്യുന്നതല്ല. It's already the patient is already taking the medication. We are only asked to continue the medication. അപ്പോൾ അവിടെ for whichനെ കാലം she was advised to continue fluticasone 250, 2 puff daily with Ventolin, 2 puff 4 hourly. Okay. So we have done with the second body paragraph as well. Here moving on to the last paragraph, that is third body paragraph. This is about the patient history. Patient in the history. She has had asthma, hypertension and depression, for which she takes ramipril, paroxetine, fluticasone and salbutamol 2 puffs as required. Is there any mistakes in the third body paragraph? Third body paragraph, patient in the history. First body paragraph we done with the today's complaint. Second body paragraph we done with the initial and the second visit part. Third paragraph is all about the social and medical history. Social നമുക്ക് എഴുതാം. ഷീസ് ജസ്റ്റ് അഡ്മിനിസ്ട്രേറ്റർ. അപ്പോൾ കാര്യമായിട്ടൊന്നും പറയാനില്ല. അതുകൊണ്ട് എന്താണ്, വി ആർ ജസ്റ്റ് ഗോയിങ് വിത്ത് ദി മെഡിക്കൽ പാർട്ട്. തേർഡ് ബോഡി പാരഗ്രാഫാണ്. സോ ദ സെൻറ്റൻസ് എങ്ങനെ തുടങ്ങണം? നോട്ട് വിത്ത് ഷീ ബട്ട് വിത്ത് മിസ് ക്ലെയർ. മിസ് ക്ലെയർ ഹാസ് ഹാഡ് asthma, hypertension and depression, for which she takes ramipril and the rest of the medication as required. This is the only correction here. Clear? This is the body paragraph, third body paragraph. That's the medical history. MH. we are done with the third body paragraph. And the last part of the sentence, that is the discharge plan. It would be appreciated if you could provide immediate assessment and management for Miss Claire. This is the only thing that they have been asked to do. So is there any correction in the discharge plan? It would be appreciated if you could provide immediate assessment and management for Miss Claire. Yes, is there any mistakes in this? It's an urgent. Introductional we used urgent. Here we wrote immediate. Assessment and management. Same word തന്നെ പോകണം എന്നില്ല. അവിടെ നമ്മൾ എന്താണ് assessment ഉപയോഗിച്ചു. Here we can go for evaluation. Instead of management, if you could അവിടെ വേണം. If you should be there. And instead of management, we can go with treatment in order to avoid repetition. Introduction la adhe word use cheyade repetition avoid cheyan. It would be appreciated if you could provide immediate evaluation and treatment for Miss Claire. That is the discharge plan. Adana in the discharge plan parayunnathu. Okay, so that's all about the discharge plan. And next, how we are supposed to conclude the letter? The conclusion, that is in the next line. Please contact me for advice, information. Please contact me for further information. Full stop. That is the concluding line. And what is the ending clause? Yours sincerely or faithfully. Reader na perundo illeo? Yours faithfully. Exactly. Yours faithfully. Evaluate yours faithfully. And what's the designation of the reader? Writer designation endana? Nothing specific ആയിട്ടൊന്നും പറഞ്ഞിട്ടില്ല. സോ നമുക്ക് എന്ത് എഴുതാം റൈറ്ററുടെ ഡെസിഗ്നേഷൻ? നഴ്സ്. യുവേഴ്സ് ഫെയ്ത്ത്ഫുള്ളി നഴ്സ്. ADVICE advice, that is noun. Noun should be there. Mostly നമ്മളത് ഇൻട്രൊഡക്ഷനിലാണ് ഉപയോഗിക്കുക. അപ്പോൾ പ്ലീസ് അഡ്വൈസ് എന്നൊക്കെ പറയുമ്പോൾ ADVISE വേർബാണ് അവിടെ വരേണ്ടത്. So നമ്മൾ writer designation if does not mention anything specific, so we can simply go with nurse. So I hope you people got an idea regarding this letter. We dealt with the introduction, then the initial first body paragraph, that is about the today's complaint. Second body paragraph was about the initial and second visit. Third body paragraph we included the medical condition. Isn't this letter formal? So can we use dear at the beginning of a salutation? Dear പറഞ്ഞാണ് നമ്മൾ തുടങ്ങുക. ഇപ്പോൾ എല്ലായിടത്തും dear നമ്മൾ accept ചെയ്യുന്നു. Not only in OET but for all kind of official letter. Dear sir or madam. ആദ്യം അൺകൗണ്ടബിൾ എല്ലാം എഴുതുക. അത് കഴിഞ്ഞിട്ട് കൗണ്ടബിളിന് മുന്നിൽ ആർട്ടിക്കിൾ ഇട്ട് എഴുതുക. ഓക്കെ. ആൻഡ് ദ ലാസ്റ്റ് ഇസ് ഡിസ്ചാർജ് പ്ലാൻ. Conclusion, please contact me for further information. Yours faithfully, nurse. All right, yeah. So I hope you people got an idea regarding the question. Yes, definitely, Shiji. I'll take up all your questions for our next session. I'll clarify that. So that's the end of our today's letter, today's writing session. So kindly go through the entire video and try to come up with the better version of yourself. I hope it will be useful for you people in some way. So thank you so much for your constant support and participation throughout the throughout the live session. So keep on supporting and we'll be coming up with more ideas. And I have gone through all your other questions as well. I will be collecting it later on and be addressing it through some way. Okay, either I will be commenting in the comment box of your chat അല്ലെങ്കിൽ നമ്മൾ next class അതെല്ലാം ഡിസ്കസ് ചെയ്യുന്നതായിരിക്കും. Okay, so thank you so much everyone. Thank you.